Hey guys, Dr. Kerby here in my backyard. I wanted to bring up another topic that's commonly brought into my office, and that's nerve impingement, aka sciatica, carpal tunnel, thoracic outlet. There's a bunch more, but those are the common, probably hot button names that majority of you guys have already heard of and have heard someone discuss those things. It's super important to find the right therapist when you are working on a nerve issue, and someone that can trace it from the brain all the way down from the nerve root and then hot spots. So like on carpal tunnel with the median nerve or the ulnar nerve, you've got to be able to palpate that and see where is this nerve. So it needs to glide in a sheath. So the nerve goes with the sheath around that. And by nerve flossing, we literally mean it flosses through. As I lengthen and move, that nerve has to move back and forth. So when carpal tunnel, you'll get trapped here, you'll get trapped here, you'll get trapped here, and you'll get trapped in the wrist. You have to find someone that can know how to undo each of those areas. That's why a lot of times on surgery, they'll only release here and then symptoms will come up higher, or the symptom will move around. Same things with sciatica. And you have to be able to find, a lot of the times on the backside, so on your glute here, following that line, it can start with as simple of just sitting on hard bleacher stands repetitively, or a sitting desk job creates an impingement there. Then you go to an activity, or you're like, hey, I want to start a marathon, I want to do 5K races, 10K races, whatever that may be, and then the sciatica just blows up out of nowhere. Well, it was on its way. It's the nerve, when you went to do the running action or whatever thing, it cannot slide. Again, just the same way I showed how my arm needs to move, the leg has to sit and move the same way, and that nerve has to floss with that movement. The biggest thing that I discovered, it was based on, this is, I want to say around 8 years ago, I was reading a surgery article, and they're talking about how the surgeon cuts in and they grab the nerve and then they'll just move it inside of there. And I said, well, why do they have to cut in? You can palpate and feel that, grab it and move it. And once I figured that out, you can prevent most of these surgeries with the thoracic outlet, sciatica, radial nerve, whatever nerve impingement you have to have someone who knows how to palpate, move, hook on those nerves, and physically actually sometimes flick and release them. When you do it right, you'll feel it on the sciatica, you'll feel it all the way down the leg, on the shoulder, and others, they'll get it down to their hands and they'll know you are on that exact nerve. And it's the key training is figuring out where exactly is it impinged, and many times it's with an old injury, or it can start with a concussion, and then the way you compensate from there, it gets hooked up. So sometimes we have to do a lot of work on the head and figure out on the motor centers of how to relay it, and a lot of times that's within PMF or frequency specific microcurrent will connect those two to get the nerve to floss and neurally re-educate it. So the biggest takeaway is find a therapist when you have someone or know someone who says the hot things, sciatica, thoracic outlet, carpal tunnel, and any nerve that it may be of an impingement. If they're not getting a result with their PT, their chiro, their ortho, their neuro guy, they're not finding where it's exactly hooked and stuck to unwind and floss it free. They may say the word, oh, we're flossing it, but they're not. If they're not able to palpate it, get on and physically release, and your strength should go up instantly. This should be in one session, you'd be like, wow, most of it's gone. And then maybe you need some follow-ups to tweak it after that and find out exactly what's gumming up down that nerve line. But that's my overall suggestion is when you find someone, really make sure they can palpate, find the nerve, and show you the instant change. It should be instant. That's the kind of the rule in the office. I want to show you something right then, right now. And if it comes back and something moves, it should be completely different if we have a follow-up where I have to rethink and do a problem solving for you. So that's a big one, and hopefully I can help you, or you can find that right person to help you. God bless.